9:33 here, Big 550 KTR. Senator Kit Bond is joining us here in studio to talk Medicaid expansion in the state of Missouri. Senator Bond, it's very convoluted. Healthcare in general is very convoluted. People don't understand their own health insurance, no less trying to figure out how we're going to cover uninsured people or indigent people or how it works now. There's an idea that's floating around, it was in the story in the paper today, that they might expand Medicaid in the state to cover things like dental bills and things like that. And in the story, it says that they'll use state funds, and yet the state will have to kick in 30% of the funds, and the feds will kick in 70% for this dental care. Mm-hmm. But with this Medicaid expansion, the feds will kick in 100% for the first number of years, and then the state will only kick in 10%. So it seems like the legislature, and I know this is a convoluted question, but it seems like the legislature is rejecting more federal funds and wants to spend more state funds on less health insurance.
You've identified it. You've dug deeply enough to figure out what the problem is. And some of the people who are supporting the expansion for dental care are the ones who are very questionable on really reforming and expanding Medicaid to pay for it. So if you're scratching your head, you're right with us. If it's totally confusing to you, I just can't understand why they won't use the federal dollars that are available to do what apparently these good senators think is absolutely essential.
Yeah. Going forward, if we turn down this federal money, we were talking here on the break, and I want you to say it. I want everyone to hear you say it. You think that if we turn down this federal funds, our own health insurance policies will go up?
Very simply, I've been to emergency rooms to see what's happening. They already have long lines there. Too many of the people going to emergency rooms don't have high requirements for health care. Too many of them have moderate problems that should be solved at what they call the primary health care area, which can be supplied by community health centers and other primary care centers to keep them from going in. Now, when they go in, it raises the cost to the hospitals. And the hospitals, the only way they can afford that, they have to charge more for their services. The insurance companies take into account the additional payments. And as a result, you would see health care premiums next year in Missouri for everybody who is working and paying their own health insurance premiums. You'll see those premiums skyrocket. Everybody is complaining about the premium increases in the Obamacare plan. People have lost their health care insurance, and they're seeing the premiums go up. Well, Missouri is going to get an extra kick in the pants.
Right.
Yeah, that's
you and I are on the same page,
we're
Senator.
thinking exactly the same thing. And I think it's ridiculous for us to be paying federal dollars for health care to the federal government and then refuse to take them, so we pay more in health insurance premiums because the state legislature is rejecting the opportunity to get money back in to provide the primary health care that these needy people must have.
As a United States Senator, you were, not only did you not shy away, but you championed the fact that you brought federal dollars home in all sorts of different ways.
None more important than what we did for health care for those in need. And the idea of community health centers was one which only developed in the last 20 years. And we have an excellent group of health care centers, some of them like Grace Hill and in St. Louis and a number of others. They're across the state. They play primary health care to anybody who needs health care. They can walk in and get primary care. Now, those are ones that are going to be cut off. And Connect Care in St. Louis has already, they don't have the money to keep going. This is how we should provide the most efficient, effective, compassionate care to people who need health care.
Senator, there are people who are listening to this, who have voted for you, who are Republicans through and through, who are fiscally conservative, who are yelling at the radio saying, Senator, we don't have the money. The federal government does not have the money. We need to turn this money down.
Well, you could say the same thing about the money that the federal government spends for highways, roads, and bridges. They spend on education. I think they have too many controls on education. Community development, housing assistance, defense. If you take that position that we can change the federal deficit by refusing to take dollars that the federal government has available, you're taking it at the wrong approach. You need to elect people to Congress and to the chief executive's position who will stop this overspending, balance our budget, cut out a lot of wasteful spending, and stop rolling up the debt on our children and grandchildren's credit cards.
You are from Mexico, Missouri. You are champion city, county, and rural. What happens to rural hospitals and rural health care if the state rejects this?
We're already seeing it. We're seeing it in Nevada, Missouri, West Plains, Mexico, Missouri. The hospital there joined with Mercy Hospital, fine St. Louis institution. They had to cut $10 million last year. They have to cut $4 million more. Couple of the finest young physicians at the Mercy Audrain Medical Center have gone elsewhere. And we're going to see states around us that have that Medicaid expansion coming in and offering bonuses to top quality health care providers to get them moved to other states. And the people in the rural areas are going to face really an absence or a lack of health care available. And it'll be happening in the cities as well. And incidentally, we are now have a foothold in St. Louis, and I work with Thompson Coburn here in town, a great law firm. So we're very much concerned about the impact on the cities as well as on the countryside. And both areas are going to get clobbered if we don't expand and reform health care.
What percentage do you what are the odds you're putting at you and Ryan Silvey and the rest getting this done?
Well, I can't put the odds on it because it's the leadership. We've talked with the leadership of the Senate and urged them to sit down with their members and with the governor and come to an agreement. If they will do that, and people will listen to how this doesn't hit the state budget. This money is going to be covered by the Medicaid
by the
reimbursements,
right.
and the savings. There's enough money in it projected, so there won't be any cost. But Ryan has set up the Budget Protection Fund in case there is any shortfall in future years, and beyond that, possible take a 1% cut out of existing health care providers. But so long as they're getting the 99% in Medicaid, it's a good deal for them. So we've got it set up. Ryan has a plan that will do the three things that we want: protect the budget, reform welfare payments and Medicaid, and it appears now they can get a tax cut, too.
Well, I will say this, Senator Kit Bond. It's interesting. You haven't had a tax cut in the state for 100 years. Last year it was vetoed and it was stayed. Republicans actually voted with the governor and stayed his veto on that tax cut. You're saying that there's a deal working down there that a tax cut, the first time in 100 years, all you have to do is take federal funds to insure your people cheaper and better, and there are some senators who won't take that deal.
You got it in a nutshell.
All right.
We'll frame that and send that out. Do you have any other stations that will carry if they'll carry that one line from you? If we got radio stations across Missouri doing what KTRS is talking about, we may get a way out of what is a very, very difficult trap that we're in right now.
Well, most radio stations don't let the facts get in the way of a good rant. So
okay.
we like to deal in facts here at the Big 550 KTRS. That's the news of the day, I think. Senator Kit Bond, I've been interviewing you for 15 years. You have always been respectful. You've always been nice. I consider you, I don't know if we're friends in this adversarial position, but I thank you for all of your kind words over the years.
McGraw, listen, I know it would be a killer to say you're a friend, but
Yes.
I say I respect you. It's always a great opportunity to come on and talk with you. You're doing a great job pointing out the facts on this very, very difficult and very important issue. So thank you for what you're doing. It's an honor to be with you, and I hope that message gets out loud and clear.
We will, anytime you need, anytime you want to come in, you're more than welcome. And if you bring barbecue, you're even really welcome.
Oh, I know barbecue.
Yes, you do.
I know barbecue.
Yes, you do. You know barbecue.
I'll take that. We may have to come in with a big platter if it gets down to the end.
There you go. Senator
Thank you,
Kit
sir.
Bond, happy Easter. Thanks for checking in.
Happy Easter to you.
8:44 here, Big 550 KTR.